This is my video on changing and putting on an ostomy bag on a stoma. And don't forget the usual thing. I knock on the door, identify yourself, follow the standard procedures and facilities that you're working for. Make sure that you have permission to do this task and it's within your scope of practice. Make sure that you read the care plan before you enter the room. Sanitize your hands before you get into the room. Make sure that you have all your supplies, that you have the right person, that you have the right, whatever it tells you on the care plan, that you have the right size of or the right type of bag to change, or the right system to change, and anything else on that client's care plan in which you may need to know. Once you've identified the client, if the client is unconscious, you would need to have a third person identify the individual, that is indeed the unconscious person in which you're changing the system on. Knock, knock, knock. My name is Lori. I'm your healthcare aide today. We're going to change your ostomy bag. If that's okay with you, you're Mr. Smith. Great. And you ID the person, then you're good to go. Make sure that you have all your supplies. I have brought all my supplies. I have brought a washcloth. I have brought a towel. I have brought a waterproof pad. I have brought paper towels. I have brought toilet paper. I have brought several changes of gloves. I have brought the ostomy system. I have brought the chart to be able to know what size the stoma is. I have brought a pen in case there's no markings on the bag that you can actually use this to chart the size of the stoma on. And we'll show you that after. I have brought a barrier cream. I have brought a deodorizer for the bag. I have gauzes. I have a basin of water. Soap is not recommended because the agents in soaps will take longer and may irritate the skin also around the stoma, take longer to dry. So you just use water. The soaps may interfere with any barriers put on the skin that may be needed to put on the skin, and so you would just use warm. Make sure you have a temperature to check the temperature, and your washcloth and towel and all that stuff. The pen you may also need in case you need to check the vital signs of the patient, or anything else that you find unusual. You just may want to write it down on there, or something, and you would have it right there. If the patient said he was in pain, you would question him and find out where the pain is before you would do the procedure. So right now we have and don't forget your garbage, your two disposables. If you need, you would also have two basins, one for the water and one for the disposal of the bag, the unit itself. It would be put in the appropriate disposal, not just thrown in the garbage. Often I find I have seen videos where you would double bag it. They put it in a bag, and then so that I imagine because no odors would escape, and then you would again put it in a second bag. So just depending what standards and facilities are within the workplace you're working, that you would have to follow. So right now we have the stoma. You would examine the skin around it to see. It's normally supposed to be red or pinky red. It's moist. It should be moist. If there's any sign of irritation or discoloration around this area of the stoma, you should notify the nurse and let her know. And any other observations in which you may notice when you change this. The best time to change the ostomy system is when it's 1/3 full, or usually in the morning when the stoma is less active, or when the person knows it's less active is also a really good thing, so you don't have so much spillies all over the place. Now, some people put, depending how this client is lying down, but most of the time they tell, it's recommended that the client should be in a Fowler's position, sitting on the bed, or sitting on a chair, because your skin can fold into the stoma and create blood, like it can stop it from, it can go inside there and you would have all the skin and it wouldn't be able to drain properly in there, and this may loosen up and all kinds of reasons. So being in a semi-Fowler position makes sense because the person would naturally be sitting up most of the day or in that type of position. So once you've examined the skin and have the client sit in the proper position for you, you may have a waterproof pad. You may have to put it under the client. Have the client assist you as much as they can. Explain the procedure to the client because they will be doing this at home. I don't have the room here, so we're just gonna put this under here if you had to. You can use a towel, or you can use paper towel or anything else around this stoma while you're cleaning it, just so you don't have any stuff leak on anybody. So before you get started, you sanitize your hands with proper sanitizing methods that you have been taught. Have several pairs of gloves. You apply the gloves. Make sure that the bed's brakes are on and all that, safety check. Don't leave the client without the bed rails up and all that happy stuff. Two disposable containers are there. You could have a bag right on the bed for the tissue or whatever else you need to dispose of, could be right there. The basin for the bag, you would put the bag in a basin and cover it with a paper towel or a towel so the odors wouldn't expel into the room. So right now, let's say we took this all off and the stoma is exposed. So I'm just going to do it with no bag on there, and then I'll explain how we take the bag off and then throw the bag away because it makes more sense to me. So once you have taken the bag off and the area is exposed, you can take a piece of tissue, toilet tissue, which saves, it's like wiping anything else. Make sure there's no tissue. Try clean it off as much as you can if there's excess, and dispose of this in the right disposable bag or a piece of paper towel. Now, when you have a bowl full of warm water, then you could proceed to wash the stoma. And when you wash it, you just clean it very gently, patting it, turn it around, make sure it's all clean, and don't be afraid to, there's no sensor tissue in the stoma since it comes from the inside your intestines, whether it's the small one or the large one. So you pat it gently from clean to dirty to clean it. Rinse your cloth. Take another towel. Take a towel and the same method, dry it very thoroughly. The skin has to dry. We're only using water. Don't be afraid to touch it, for sure. Some people, when they're done this, or you can use a gauze to wipe it, or you can use a gauze to clean it with some water also. Some people say that before they put this on, they put a gauze over it. Why? I don't know. Maybe because secretions will come out or whatever. But you could possibly cover it if you had to leave and go and do something else. These are my gauzes. You can also dry it with gauzes and the towel. Any barrier cream that is put on should be put on and dried, depending what the, this is my barrier cream. So what I have done now, when you measured this, stoma, you use the measuring chart to measure the correct size, and you actually can place it right on there. You don't keep these charts. The charts come as far as they come every time you have a bag, so you get probably pretty good at judging what size you need. And we have picked this one, which is actually, I picked a different size. I had, this is the one I picked, which was 38 millimeters, this one right here, that leaves 1/8 of an inch around the stoma, which gives it a little bit of room. You don't want it too tight, and you don't want it too wide, otherwise you might run into a lot of health problems. So judging the size of this, the spacing, once you measured it, should be about 1/8 of an inch around the diameter on the outside, so that it makes it quite comfortable. This would get thrown in the garbage. I have pre-cut mine here. I'm not going to peel the back of it off because I want to show you how to drain it. So once you've cut this to the correct size, mine was 38 mils, the barrier cream would go on the back itself, or this would go on around the stoma if it asks for it. The back of this would be peeled off. You see the measurements on the back, so you would set this here, making sure that it fits, not perfect, that you can see it, and try not to leave any jagged edges there. Make sure it's all nice and so then this part of the bag, which has a clip, can be clicked on. So once you have your barrier cream on there, we're pretending this one's brand new first. You wouldn't be doing this task. The nurse would be the first one to show you to do this, and then after she has shown you to do that, you have been shown the procedure on a client, then you would be therefore, and this just clips into place. Let's hope we get the clip on here. It's not too good. So this actually just gets clipped on with pressure. You can actually hear the clip. I don't want to ruin this. I'm going to take this off so you can actually hear the clip. So once you place that around the stoma, this clips into place, and you can actually hear it clip into place. You need to hear that click happen to know that it's sealed. And once this is on the client and around the stoma, you have to apply pressure. So you slightly push a little pressure on the bag and hold that, because not only does the pressure get it to seal properly, but the heat also activates that, and you get a much better seal. The length of time for that is approximately 2 minutes, or whatever the instructions on the barrier cream give you, but it takes about 2 minutes. So you could get the client to help you do this. So once this is in place, you can actually test it. You can actually test how firm it is, how it's adjusted. Now on the bottom of the bag, this is the interesting part. This is the part that's really interesting, is that a lot of people folded this like several times. Some are all kinds of weird ways. But what really happens is you have this clip, which has a little release thing. So you release it and it clips, and release it and it's just kind of like a sort of like a clothespin. So you slide this, put it over top of the bag. I'll show you how much. And the reason you do this, and I didn't understand it, and I wish someone had said, but there is a reason for this. And I'll show you what the reason is. So once you got it positioned over top of the bag, make sure there's no wrinkles in anything. It's all nice and smooth. This clips into place. And if a person was wearing their bag on their hip or their thigh, and they wanted the bag to go lie so nobody would see it, you would clip the clip to the bag the way that their leg is formed. So their leg, you would see the bag less in the curvature of the clip. So you want to clip the bag properly for the client. So you would just make sure that it went to the curvature of their body. So if you just turn it around so that it would lie like I did, and it clips into place, and you must hear a sound. Now this is the interesting part about this excess part, which is what I wanted to show you later on how to change it if this was here. And once this is on, we will show you how to change it. So once this is on, you would clip this in the curvature of their body. If you practice opening and closing that clip, so it just goes on and clips. So you can actually hear the clip, because you could have problems with that. So whichever curvature, which hip they are in the curvature of their leg, you would clip this bag. And you would either hang it from their belt, or you could have it attached to, there's little clips here, you can attach it to their waist belt or their leg, or wherever else they want the bag to be attached to, of course. So now you have this on, make sure your client is okay, make sure, oh, and don't forget to change your gloves. I forgot to change my gloves. Once you touch that stoma and you've cleaned it, clean and sanitize your hands. So really, through this whole process, your gloves should be changed at least 3 times. I was so excited about this little part about changing the bag. So if you did all the right procedures, safety, brought all your supplies there, and this bag was on. This bag was on the client. If this already existed on the client, you would have adhesive remover, because partially some of it would stick to this. It might stick to the skin and you need to remove it. You would remove this from the top. You would press the skin slightly down so you create pressure into the skin, so it would remove on its own. It moved on me. That's too bad. And then you would move it from the top slowly around, applying pressure to the skin, and remove the bag. So once it has been removed, you fold it, put it in the proper disposal or the basin. Let's say if you had to measure and look at it, and also if it's in the basin, it also lets you, if it's put in the basin, you look for discoloration, you look to see the amount, maybe odors or anything unusual in the stool. So, and you may have to measure it to see how much. So, when the bag's in the basin, you could cover it with a towel or a piece of paper towel, just so the odors remain masked. And then it allows you to carry it. So once you've taken the bag off and disposed of it, you would change your gloves. So this is as if a system was already on and you took it off. The gloves would go. You examine the skin, make sure the client's comfortable, all of that stuff. Put your gloves back on. Proceed with washing with water. Water is preferred because soaps interfere with the barriers and can irritate the skin. You've had the right ostomy system to put on the client for the colostomy, or for the sternum. You've got the right size. You already have that. You've cleaned the skin. I'll show you how to clean the skin again. Wipe it with tissues. Examine it. Wipe it with tissues. Any excess around. Make sure you have a towel to protect things. Use toilet tissue. Make sure it goes in the proper disposal. Possibly even paper towels. And then change your gloves. Make sure I have another pair of gloves here. We'll just pretend we have another pair of gloves here. Sanitize your hands. Make sure that you have all that safety stuff around you. Check the brakes, the bed, all that stuff all the time. So now you've washed this. You've cleaned it. Take a washcloth. Clean it gently around in a patting motion. Clean it on the top. Make sure that this goes in the basin with water. Make sure the water's tested. Towel dry it. Pat it. Don't be afraid to touch it. It doesn't really have any feeling. Also, you may have some tinge of blood color just come from cleaning the sternum, which is normal as long as it's not leaking. The towel goes. Change your gloves. So we'll change our gloves again. We'll grab a fresh pair of gloves. I think that the fact that once you've touched something and then you go to touch any part of a human's body, those gloves need to be changed. Make sure you remove your gloves properly too. So we've washed this, we've dried it, air dry it for a while, make sure it's dry, put your ostomy pre-cut system or whatever system that the client is ordered to do onto the client. Hold this in position, make sure it's pressed with no wrinkles, evenly around. Everybody has different ways of trying to get this to stick. I think the smartest method is exactly what they said. Make sure it's all smooth, make sure it's properly clean, make sure it's properly dried is 100% a good reason. Keep a hand, have the client help you as much as they can. Tell them about the procedure. So this would say at least a couple minutes, or whatever the barrier cream tells you that you need to do. So once this is all dry and and you've cleaned up all of your supplies, I'll show you how to change this bag. If we just change this bag, the bag or system can, the bag can be changed at 1/3 full, or 3 to 5 days, depending on. But usually, when this type of bag, it's usually changed when it's about 1/3 to 1/2 full. So what happens is, and you can use this clip too, right? So what happens, this is how you drain this bag. This is the cool part about it. Is the reason when you unclip this, let's say this is filled up with stool, right? And this is clipped. So what would happen is, what you could do is this bottom of the bag, is you turn it over. I've seen someone do this. I don't know if this system will not allow us to do this, but I'm going to just try to give some support here. If this has more access, well, it still does. This method is called cupping. So this is filled with stool, and what would happen is this excess part of the bag, bottom of the bag, you would turn it upward. Turn it this way. I don't know if you can see it. So there would be, when I saw the video, is at least a couple inches. So if you were to drain this bag, and this was long enough, you could cup the back of the plastic and empty the stool. So if you open this up, you would create like a funnel almost, and you'd be able to drain this you'd be able to drain the bag, and you'd be clean. So if you turn this upside down, it's called the cupping method, and people, you can do this at home, and if they were using it at home, and dispose of it into the toilet, because they could cup this, and then they could actually, once the bag is empty, they could actually clean this with tissue. I'm just going to put that there. Clean this with tissue, and they could put it into the toilet and clean this bag without getting any contamination or even touching anything. This part could be actually cleaned. So once this is turned back over, it's totally usable again. Now, if you're putting any deodorizers into the bag, someone actually said something else that was really interesting. You would just pour the liquid into the bag. Some of these systems comes with filters. This one is just a straight bag. The other method is to eliminate fluids out of the bag. So you just put the liquid into and somebody said that they kind of squish it around. Once they put the liquid deodorizer into the bag, they just squished the bag a little bit so that the deodorizer went all over the bag and just didn't stay in one place, which I thought was pretty good. Then they also said something else about rinsing this part of their bag in a sink themselves in their own home to keep it clean and free of any contamination. Make sure this clips in. Make sure that you have, so that is changing an ostomy bag. What else can I think of here? Make sure you clean up all your supplies. Make sure the client is comfortable. Make sure you followed all the safety procedures. Don't forget, this is that only use what's on the care plan for that individual client. This was my barrier cream. And make sure you dispose of all your supplies in the proper places. Remove your gloves. Bring the bed back to the proper setting if the client's in the bed. Practice all the safety methods. Put the brakes on the bed. Put the call belt next to the client. Wish your client had a nice day. And there you go. It's not a very good demo, but I wish I had a live person. That'd be way more fun. But that's how you would change an ostomy bag and apply it. Never do anything beyond your scope of practice. Make sure that that if anything that's concerning, that you report to the nurse immediately. Thank you and have a great day. Ron?